please.
Ivan, are you able to see the screen?
Yes, doctor, we can see the screen. You can please proceed.
And I'm unable to share my video. Ivan, I need rights to share the video. Maybe I start as I get those rights.
Yes.
Good afternoon to you all. Thank you very much for this opportunity to share with you current knowledge about the fight against COVID. I want to thank Ivan for the kind introduction. And I also want to thank the Innovation Village for giving me an opportunity to share the current updates in the management against COVID. So, thank you, Ivan. Like you've been told, my name is Dr. Keith Kakame. I'm a medical officer working with Mulago Hospital. I have expertise in public health, and I'm currently a senior house officer in the Department of Internal Medicine at Makerere College of Health Sciences. But particularly, where I come to talk to you today is that I've had an opportunity to work with the COVID treatment unit in the period of December and January. So I have come to share with you what I experienced and what I've learned over the months. So I'm going to look at the introduction of how the COVID fight has gone thus far, and then I will look at how COVID interacts with the body, and then I will talk about how we can prevent contracting the virus. I'll talk about the signs and symptoms of COVID, and then I'll talk about testing for COVID and how to care for COVID patients. Now, I have given this presentation before. In fact, that's where one of the members here who requested me to come and speak to you. And so I've made changes to this presentation, but probably some of you will find that I've shared this conversation before in other fora. So just to give you a highlight about this pandemic, COVID-19 pandemic has affected the whole world. Literally every country in the world has been affected by COVID-19. And it's caused by a virus known as SARS-CoV-2. As of now, we've had more than 176 million infections in the whole world. This is in a population of 7.7 billion. And much as there have been many people who have been infected globally, we still have a significant number that has not been infected. And of those who have been infected, so far, 3.8 million have unfortunately passed on. And this represents about 2%. So again, not everyone who gets COVID dies. As you can see, over 160 million are still recovering, and another fraction is still in hospitals. And as a result of this pandemic, we have the biggest vaccination campaign going on in history. And so far, over 2.4 billion doses have been distributed and given to people globally. Here in Uganda, we've managed to give about 800,000 doses, which translates to 0.01% of the country. So COVID affects people differently. I need to emphasize this, that not everyone who gets COVID will die. Not everyone who gets COVID actually ends up in ICU. No, the risk varies across different groups. And data from the Western world shows that 80% of people who get the virus develop no symptoms. It's only about 20% of the infected who go on to develop symptoms. And even those who develop symptoms, not all of them end up in hospital. It's a small fraction of about 20% who eventually end up in hospital. But this varies from country to country, and it varies from variant to variant. The latest information I got from the Ministry of Health is that for us here in Uganda, it's 50-50, meaning that half are infected and have no symptoms, and the other half are infected but develop symptoms. And the other point I wanted to make is that COVID is one of the many pandemics that have affected the globe. From time immemorial, pandemics have always affected people. In fact, some are biblical and they used to be called plagues. But I just wanted to make mention of some of the pandemics that have been recorded in history, particularly in Europe. In 1347, we had a pandemic that wiped out almost a third of Europe. And then around 100 years ago in 1918, we had another pandemic called the Spanish flu, which wiped out over 50 million deaths. So because of this past history, some of the interventions you'll be seeing coming in are driven by the fact that if a pandemic is not put on hold, it can cause serious damage. Particularly for Uganda, COVID has been here since March 2020, and the first 6 months of COVID in the country were largely quiet until about November, December. That's when we had the first wave. But when this first wave came, it found when there was already work done, the public was sensitized, surveillance had been done, and we had had a lockdown, which allowed the health sector to do some preparations. And so when the wave came in December, it was well taken care of, and by January, the cases had started reducing. So last month, in the month of May, another wave came, and this time it came at a time when the community was not prepared and everyone was going about their own business, and many variants came in at the same time. We had different variants. We had the Delta variant, Beta variant, Alpha variant. There are so many variants that are available that are responsible for this wave, but majorly it is the Delta variant, which is highly transmissible and can easily cause severe disease. So this is now the second wave that we are experiencing. Many other countries have experienced waves. Kenya has already experienced 3 waves, and in fact, they're preparing for the 4th. So when the wave came in, cases increased exponentially, and good enough, there was more awareness, there were more testing facilities, and so this is where we are now. We have so far officially 64,000 people infected, and like I told you, half of these are likely to have been asymptomatic, and another half have symptoms. So this figure of 64,000 is since COVID started, but in the last 1 month alone, we've had 20,000 infections. And one statistic that shows you how much community transmission we have around is what we call the positivity rate. The last time I checked, the positivity rate was about 15 to 16%. Now, the positivity rate is the fraction of people when the samples are tested. If you test like 100 samples, how many are likely to be positive? So this is about 15 to 16%. That shows you that there is more COVID in the community. When you check around March this year, we had about a positivity rate of 0.1%. So from a positivity rate of 0.1% to a positivity rate of 16%, this shows you that we have a lot of COVID in the communities. And some of the reasons why the COVID that have been given for COVID spreading very fast is congregating, people coming together in areas such as schools, in buses, in churches. Another key feature about this wave is that mainly the young people are affected, and that is between the ages of 20 to 39. As far as vaccination is concerned in Uganda, so far about 800,000 Ugandans have been vaccinated, and that translates to 0.01%. So our vaccination coverage, much as it has been blamed for this wave, is extremely low. And SOPs are in place. We're encouraging people to social distance, to use face masks, to do hand hygiene. All right, so I'll quickly talk about prevention of COVID for everyone, because this has come up as one of the questions. How do we prevent ourselves from getting the virus? And for those who have the virus, how do you prevent it from passing on to your loved ones? So I'm going to use this image to highlight how COVID infection moves from one person to another. I will start with COVID, which is in this circle, that has moved to one person who is now infected. So when COVID infects a person, it multiplies and makes babies. Now, these viruses that have multiplied have to move out. And how do they move out of this host or the reservoir? They move out as someone is breathing. The simple exercise of breathing takes out viruses. As someone is breathing, as someone is talking, as someone is singing. So you are told that COVID only spreads through sneezing and coughing. No, as someone is breathing, is talking, is singing, they are letting out small viruses. And so when these viruses come out, they enter the environment, they contaminate the air. And so some of the droplets, which are small, depending on how close you are to the person, in fact, as they talk, they can deliver viruses direct to you, especially if you have no mask on. The virus will, or if someone is speaking loudly or singing at a high tone, the viruses will actually move. But then some viruses may settle on surfaces, on a laptop, on a phone, on door handles. And so these are the viruses that stay, and if, in case someone touches any of the surfaces, they will transport them to the next host. Also, if you stay in a poorly ventilated room, some of the viruses will stay suspended in the air. And if someone enters, they could actually stay in the air for up to 6 hours, according to some studies. So that's why we encourage people to have good aeration, good ventilation, and we discourage fans, because fans tend to circulate the virus in one area or in the same environment. So once the viruses come out, then they move into the air, like I've mentioned, and then they will enter either through your mouth or eyes or the nose. So mainly they enter through the mouth or nose, and then they attach to the new host. So because they enter through your mouth and eyes and nose, that's why we recommend people to use face masks, so that you close off. If someone is speaking and probably have a mask, then those virus particles will not enter the mouth, the mouth and the nose. And then for the eyes, the virus may enter if you touch your eyes. Maybe you touched a door handle and it had some viruses. Then you touch your eyes, you can easily transmit the infection. But the eyes are not as an important route of infection as the mouth and the nose. So a break in any link in this chain prevents spread. So if you want to prevent COVID, One is to deal with the person who is infected by isolating the person or self-isolating. So if I know I have COVID, it's always wise to isolate myself because I know I could easily pass on the virus to my neighbor. And so since we are supposed to be each other's brother's keeper, we're supposed to self-isolate, even voluntarily. And then we treat the infected. But the main approach for the infected is to isolate for 14 days. After 14 days, you're good to go. Now, the other measure for preventing COVID is limiting the viruses coming out of the mouth and nose. And that's why we encourage social distancing. We encourage social distancing, we encourage people to work from home, because when you're far from anyone who is infected, then you're unlikely to get in touch with the viruses. Then, cough etiquette, we encourage that if anyone is infected, they cough reasonably, they're using a handkerchief and then disposing it off well. And for preventing transmission, again, we encourage rooms to be well ventilated, to have all the windows open, all the doors open, both at work and at home. Because in case there's a virus in the environment, then it can easily be taken away by the bad air can be taken away, and then the good air comes in. Also of significance is hand washing, where we encourage people to do as frequent hand washing as possible, because all the time you're touching surfaces. You're touching a pen, you're touching a phone, touching a door handle. I mean, you don't know if there are any virus particles on those surfaces. So that's why we encourage that you hand wash as much as possible. For port of entry, use of face masks is very important, because face masks will help you from not getting the virus into either your mouth or your nose. And then for the uninfected, for the person who has not yet got the infection, your immunity is your best ally. Your immunity is your best ally. And like I've shared before, your immunity is not developed overnight. The process starts at conception. When at conception, you pick a set of instructions from your mother and your father. And so from birth, you have an advantage depending on which set of instructions that you have inherited. And so during pregnancy, the behavior of your mother determines the integrity of your immunity. If you have a mother who is drinking, who is smoking, the child's immunity will need to be as strong as the mother who is not smoking, who is not drinking. After the baby is born, early childhood, children are supposed to be breastfed, children are supposed to receive good nutrition. And these are all boosting your immunity. And also the environment you're exposed to. We have what we call the hygiene hypothesis. The germs you're exposed to earlier on will determine how your immunity plays out. So that's why when COVID comes, it finds each individual at a different level. And a quick fix may not add a lot of value. So eating 4 mangoes in a day will not boost your immunity overnight. There's a process. It has been through a process that takes years, that takes time. However, you boost it along the way. The best measure we have against this virus is vaccination. And vaccination is very important, and I will talk more about it on the next page. Finally, one way of dealing with COVID would be to use antivirals, but antivirals are drugs which kill the virus, but now there's no evidence to show that use of antivirals is effective, except in a few cases, depending on the severity stage. And so our major approach is the approaches I've told you about. So how does the disease get established in the host? Quickly, I highlighted that out of 7.7 billion people, only 176 so far have got the infection. Okay, those are official statistics. We know that there are people who have got the infection and are not captured, but still, we have not reached a billion. So what am I trying to say? I'm trying to say that some people will actually not get the infection. Why? Because of this interaction between the agent and the host. Now, the agent is COVID. Depending on which variant, each variant has its uniqueness in its ability to transmit. So some variants can move faster to more people than others. Also, the dose of the viruses you're exposed to matters. Someone who's exposed to a small amount of the virus is different from someone who is exposed to a high dose of the virus. For example, if someone is exposed to 1,000 viruses, their immunity may be able to handle them. But this is different from someone who's exposed to 100,000 viruses. Your immunity may be overwhelmed and the infection may set in. Also, the duration of exposure matters. If I'm in a room which is contaminated, say a restaurant, and I stayed for 15 minutes, my exposure levels will be different from someone who sat there for 2 hours. So all these factors will play out in whether someone gets infected or gets mild disease or severe disease. The factors for the host I've already mentioned that the biggest factor is your immunity. And there are some conditions which change your immunity, like diabetes, hypertension, some immunosuppressive drugs, and others. And we know that when someone gets vaccinated against a specific disease, they get an upper hand and a head start in the fight against that disease. Finally, the environment here we mean where the agent and host interact. It could be a poorly ventilated room, but also it could be the behavior of the person. If someone's behavior can put them at risk, maybe they are not adhering to SOPs compared to someone who is adhering, and also some social norms can put us at risk. For example, before, let's say like the president announces that his churches or schools are closed, people continue, yet these are areas that put people at an increased risk because of the social norm of continuing the way life has been. So in the presence of the agent and host and the environment, this will determine whether someone gets the infection or no infection. And the possible outcomes are no infection, or you may get no symptoms, or you may get mild symptoms, or severe disease and end up in ICU. So the prevention methods that you know originate from this background, that you need to reduce exposure to the virus by following SOPs. You need to boost your host immunity. You need to make sure that if you have any underlying condition, it is well controlled. For example, your blood pressure should be well controlled, your sugar levels should be controlled, and any other underlying condition. And finally, we need to reduce community transmission, because if we sensitize the communities, change social norms and individual behavior, then we'll get an upper hand over the virus. So you may be very careful and you're following the SOPs, but your sister at home isn't, and you're staying with your sister at home, for her she's not following the SOPs, she will bring the virus home. You may be very careful, but you have a maid who is not following the SOPs, or a driver. So everyone must get on board and follow SOPs for us to fight this deadly pandemic. So about vaccination, because there are many questions about the vaccine, is that the vaccine is both an individual intervention and a public health intervention. It helps the individual, but it also helps the public. When I'm vaccinated, I do not only benefit, I also benefit those around me. And vaccines have been here since 1796. That's when the first vaccine was made by Jenner, a smallpox vaccine, which ultimately led to the eradication of smallpox. We've grown up in a world where there's no smallpox, and in fact, our descendants will grow up in a world where most of these infectious diseases like polio or measles could be eradicated if everyone was vaccinated or took on the vaccine message as well. So there are multiple vaccines on the market. As of Uganda, we're using the AstraZeneca vaccine. It is safe, it is effective, and it was designed to prevent people from developing severe disease. The vaccine was not designed to prevent people from getting the infection. It was designed that when you get infected, you get mild disease and your body is able to fight it off so that you don't end up in ICU paying 5 million per day. And then it may not offer 100% protection, but it offers significant protection against different variants. So we have 2 doses, and vaccines are being developed that can target multiple variants within the same dose. So people have been asking about concoctions and steaming as potential interventions they can use to prevent or even treat COVID. And so this has been my response mainly, that there are enough proven interventions that are effective at preventing COVID. There is a lot of science that says social distancing works. There is a lot of science that says masks work. There's a lot of science that shows that adequate ventilation works. And there's a lot of science that shows that vaccination works. So, as a scientist, I recommend that, given that rigorous studies have been done that recommend these interventions, why not follow them? On the contrary, there are many concoctions that have been suggested on the market. I saw someone asking about mixing Uganda waragi with some fruits and many others. Now, if a concoction is not safe, no one has a problem with it. But none of these concoctions have been proven to be both effective and safe, except for good nutrition, which we know that if you eat a balanced diet, it protects you against any viral disease. And the balanced diet includes proteins, carbohydrates, fruits and vegetables in right quantities. I don't believe that because COVID has come, I should take more of ginger and garlic than the proteins I've been taking before. I believe that now is an opportunity to balance my diet so that I can have a balanced fight against the virus. Steaming. Steaming is beneficial in specific diseases. For example, steaming is good in allergic rhinosinusitis. This is allergies involving the nose and the sinuses. Steaming is good in common cold. And steaming generally is good because it psychologically boosts someone and it also gives some relief to the body. However, it has not been proven to be effective for COVID-19. Because when you get COVID-19, first of all, when you get COVID-19, you will never know that you'll probably be in a place, you get COVID-19, you're in a conversation. So at that time, the virus will cross, enter your mucous membranes, and start multiplying. What I've heard is that most people do not follow SOPs. All right, not most people, but some people do not follow SOPs and they rely on steaming in the evenings, after work, or even when they meet their friends to destroy the viruses they've accumulated today. Who tells you that the virus will be waiting for you until evening when you go into the steaming? You know, so steaming, as far as treatment is concerned, it may help relieve some symptoms because COVID can affect the nose and cause COVID rhinitis. So it may give some relief, nasal congestion. But the belief that it will break down mucus in the lungs may not hold because COVID mainly affects the lower lungs and the outer lungs. Herbal medicines. Again, herbal medicines have been used over the years for many diseases, but we still have safety concerns and effectiveness concerns when it comes to COVID. So I would encourage that since we have enough evidence for social distancing, for masks, for ventilation, for isolation when someone is sick, for vaccination for those who can access it, I would recommend that you follow those ones because they have worked in other countries. It's not that they're not working in, they are not only recommended for Uganda, they've worked in Australia. You can read up the literature. They've worked in New Zealand. They've worked in France, in the US. The deaths have reduced in those countries. So I need to finish this because I want to take on your questions, but quickly about management of COVID. COVID is a disease that has non-specific symptoms. The symptoms one individual may experience may be different from the symptoms another person experiences. So people come to me and tell me, I have not lost any taste, I have not lost any smell. No, for you, you may just have fatigue or muscle aches or body aches. So the symptoms of COVID are diverse and they come 2 to 14 days after exposure to the virus. You may get headache, you may get diarrhea, but also COVID affects other systems. People have come in with clots, people have come in with heart attacks. You may get your heartbeat changing or chest pain, or you may come in with a raised sugar level, or you may come in with reduced urine output. So the presentation of COVID varies from one individual to another. So once you get to know that you have symptoms that suggestive of COVID, it's important to get in touch with your healthcare provider because COVID may present like other diseases. You may have symptoms that look like COVID, but it's actually malaria, and we know malaria kills. So it's always good that when you have symptoms, you're sure that what you're dealing with is malaria or even COVID and not a different entity altogether. So on the market, you can do COVID PCR, which detects the genetic material of the virus. If it's positive, then you know that you're infected. If it's negative, it may be due to how the sample was handled or how it was tested. It is always good to do a repeat test like 2 days later. Then you have the antigen test, which is about 100,000. This one, also, if it shows you positive, it means you should start treatment. And if it's negative, you may need to repeat or to discuss with your doctor, especially if you have symptoms. But also importantly, it's important to know that there's a chest CT scan that can be done, especially for patients who have severe disease. If you have a relative who is not breathing well, they cannot move, please do a chest CT scan to assess whether there is worsening respiratory status. I must also highlight that there are other tests you need to do for COVID, because if you have COVID kidney, you need to do kidney tests. If you have COVID liver, you need to do liver tests. If you have COVID heart, you need to do heart tests. So, how do we grade the disease? For everyone who has COVID, we don't treat them the same. No, there is an approach for grading. And like I told you, in our country so far, 50% of the patients have no symptoms. And having no symptoms does not mean you cannot spread. You will have no symptoms, but as you talk, as you sing, as you laugh, you're spreading the virus. So we have a category of patients who either have no symptoms or they are yet to develop symptoms. we have a category of patients who have mild disease, and this is the majority of Ugandans. Either they may have a sore throat or fever or cough or general body weakness, muscle pains, but they don't have any difficulty in breathing. This is the majority. But then there are patients who develop symptoms that result in reduced oxygen reaching the tissues. And the only way to tell whether oxygen is reaching your tissues, we can use a machine called an oxygen machine or pulse oximeter. And if your oxygen saturation is below 94, then we categorize you as severe disease. Now, the treatment varies from person to person, depending on which category you're in. For those who are in critical category, now those are the people who end up in ICU on a ventilator with a lot of supportive care. So, COVID disease has stages. So sometimes it's important to know the stage you're in. This graph shows you from the time you get symptoms to about day 5. This is early infection, and there someone is very, very infectious. Now, from stage 2 is from around day 6 of symptoms to around day 12 or day 11, thereabout. So this is the phase, no, sorry, up to day 8. This is the phase where someone can develop difficulty in breathing, and their lungs start failing them. And then we have the last stage where there's a lot of damage going on. So what happens is that when you get the virus in your body, your immune system starts fighting, and it starts coming on around day 6. For most of the people, the fight is good. They fight amicably, and most of the time your immunity will overpower the virus. But for some people, the body overfights and releases so many chemicals in the body that result in damaging of tissues and cells. And so these are the people who now end up with a lot of lung damage. It can damage your heart, it can damage brain, and this is now the last stage. So a small fraction go on to the last stages. And as you can see, the prevention mechanisms recommended are the ones you already know. So when a patient comes, people have been asking, what do I do? I'm at home, I need to be cared for. So when you're in home care or whenever they're giving you COVID care, one, there is no specific treatment for COVID, the virus itself, but there is supportive care. There is supportive treatment. We can give an individual to fight the disease. And so the supportive treatment is to identify early worsening of the disease, to treat early, and to lessen the effects of the disease, and to lessen hospital admissions, and to prevent long-term pulmonary effects or lung effects. So this disease, for some people, does not end the day they recover. Some people get long-term damage to their lungs. And so part of the COVID care is to identify special populations like those who are above 60, those who are obese, and those who have significant comorbidities like diabetes or hypertension. So these special populations need to be monitored closely. And the treatment depends on the severity, whereby most people are treated at home and the severe cases come to hospital. So what do you do at home? As you can see, the lifestyle interventions are the most important when you're at home, which includes light exercises from home, not in the community. From your home, you can creatively come up with exercises like jumping a rope, dancing, push-ups, and other things. Then, making sure you have adequate nutrition, which includes hydrating yourself, and fruits. Any fruit on the market is good enough. And finally, among the lifestyle interventions, you need to have adequate rest. Then the medical interventions, the most important thing now is zinc and vitamin D. Vitamin C was found not to have benefit, and so now we're recommending zinc and vitamin D. But mainly their work is to support your immune system as it fights off the virus. Other interventions vary from individual to individual. That's why we don't recommend people copying and pasting their friends' treatment. You may find someone is given an antibiotic because they were told they had a bacterial infection over and above COVID, and so that's why they're taking an antibiotic. Or you may find someone who was given a cough syrup, probably for relief, or an inhaler. So it does not mean treatment for X is the same as treatment for Y. Importantly, it's good to monitor the patient to prevent worsening, which usually comes between day 7 and day 12, as I earlier showed you. So while at home, it's important to follow the home isolation practices, whose major role is to reduce infection at home. So you stay at home for 14 days, stay calm, well rested, and then you limit the number of people taking care of you, because every person who comes in touch with you may potentially infect you. And this doesn't mean you stigmatize yourself or you stay away from people, but you do it in a way where you know that you're trying to keep everyone safe at the end of the day. But you stay connected to people through phone, through video calls. Clean, frequently touched surfaces with soap and water. The virus can stay on surfaces long enough for the next person to get infected. And watch out for any symptoms, and you stay in touch with your attending doctor. The challenges we're having is that when someone starts treatment in home care, they think that's it. They wait for recovery. No, sometimes treatment does not work. And so you need to stay in touch with the doctor to see why symptoms are not going away or what you should change. So the don'ts is basically not to go to work, not to go to public places, do not go shopping, do not visit people, do not attend religious gatherings. Recently, someone called me that they were self-isolating and he had other 3 friends who were self-isolating. So they wanted to meet and have a cup of coffee. So I was like, no. In the process of meeting, first of all, you don't know the variant your neighbor has. It could be the one that causes severe disease. Yes, you may all be infected, but it's not wise again to meet. So during self-isolation, you keep in a well-ventilated room. You can move out, go to the sun. It doesn't mean you stay in the room all the time. Keep a social distance. You have a bathroom which you clean all the time, and try as possible to stay 2 meters away from people in the home. Yeah, you keep 2 meters away. Wear face masks most of the time to help prevent the spread of the disease. Cough appropriately, and clean your hands very often with soap and water and alcohol-based hand sanitizer. And please, I just need to emphasize that if you're following SOPs and you people at home are not following SOPs, you're putting each other at risk. After 14 days of isolation, you can then move out of the isolation room. So while in the home care, it's important to monitor for worsening of symptoms. And we have a chart which you can use. Usually every day you monitor for difficulty in breathing. Is it worsening? If difficulty in breathing is worsening, please don't wait for the next day. Come to hospital. You can call us. We can help you to escalate care early. The challenge we have, the last time I was in the COVID treatment unit, people come in late. You find someone has been at home, not monitoring. Their oxygen levels drop. Now, normally, a person should deliver 95 to 100% oxygen to the tissues. Now, if you start delivering less than 95, then it's important to seek care quickly and promptly. Most patients, if you do a study, they usually come in their 70s, in 60s, especially at the Mulago COVID treatment unit. So you can monitor this. No one gets to 70 in one day. They usually start from 96, then they drop to 94, then they drop to 92, and before you know it, they're 70s and they collapse. So you can also monitor your breathing rate, your heart rate. This one, if health worker can help train you on how to measure this. And for those who have comorbidities, you can monitor your blood pressure and the glucose. So when you come to hospital, we individualize care, and messages have been going on, reminding people that dexamethasone is not for every COVID patient. It's for those few who have moderate to severe COVID. Anticoagulation and other forms of supportive care are also added while in hospital. But while in hospital, you know, when these patients come, you'll find that someone has COVID and they also have malaria. So you add treatment for malaria. Someone has COVID, but they have a high sugar level. So you drop the sugar levels. Someone has COVID, but their BP is very high, 200. So you manage the BP and others. So hospital care for COVID is highly individualized depending on how the patient presents. But significantly, as COVID interacts with the immune system, the lungs get damaged. So their ability to deliver oxygen reduces. So some people, you find that 20% of the lung is damaged, 30% of the lung is damaged, 80% of the lung is damaged. So this you can tell using a CT scan. And so their oxygen needs vary. And you find someone needs 1 liter, another one needs 5 liters, another one needs 10 liters. So when you come to hospital, we titrate your oxygen depending on needs. And of course, there's monitoring and a lot of psychosocial support. So when transferring a patient from home to hospital, it's always important to alert the team where you're going. It's always important to use a good ambulance to make sure that you don't expose families to COVID. And also it is important that your patient arrives alive, because people have been coming in and they die at arrival, or they die just after arrival because someone's along the journey spent a long time without the important care they need. Finally, as I conclude, just a reminder that for some patients, not for everyone, for some patients, maybe 15 to 20%, they may get post-COVID syndrome. These are symptoms that stay with them for 4 to 12 weeks or even thereafter. And someone may be fatigued, feel tired all the time. Someone may have difficulty in breathing, and may have cough, or even chest pain. Recently, a colleague also called me and they couldn't sleep, sleeplessness, or even altered sense of taste or smell. So, after COVID treatment, you may experience some symptoms that may not go away unless you get other interventions, such as post-COVID care, which is available. So some people get depression and anxiety. I know some people who got depression that stuck for 6 months. They were in a depressed state, loss of interest in their surroundings. They didn't want to do anything. So this is what COVID can do. Some got post-traumatic stress, the whole experience of COVID. It's a deadly disease. Going through the whole experience, people are stressed. So all these people need post-COVID care, and exercise can be beneficial. Some people lose memory, and some people have sleep disturbances, sleeplessness. And then there are some people who have palpitations, like your heart keeps beating, or you feel chest tightness. You know, some will cough even after the disease has gone away. But commonly they have fatigue, you feel your muscles are weak, and many others. So COVID care does not end the time you finish treatment. If symptoms persist, consult the health workers to give you post-COVID care. So what are our major take-home messages? The COVID pandemic has not only affected Uganda, it has affected households across the whole world, and we are at different levels of handling it. Some countries have handled it and they are living their lives normally. Some of you who follow football, you know that stadiums are now filling up. The Australian Open had people recently in January. Is it January or thereabout? So some countries are already ahead. Even us, we are going to get there. And COVID science is evolving. 1.5 years ago, we didn't know much about COVID. It was a new disease. And even up to now, there are some questions we don't know. But the questions that have been answered are enough for us to prevent the infection. So there are enough proven ways of preventing infection. And importantly, no one is safe until everyone is safe. Yes, you may be following the SOPs. Yes, you may be vaccinated. But how about your neighbor? Because this virus is moved by people. And we are all interconnected. That's why if the virus can start in China and end up in the remotest village in the world, then early detection and treatment of severe COVID saves lives. If patients can get their care early, I know there are very many people who are with severe COVID who are on home treatment. They are getting drips from home, they are getting oxygen from home, and some of it is suboptimal. Just to encourage us that if you have a relative, make sure that they are under the care of a good internal medicine physician who another good, well-trained doctor who is taking good care of them. And finally, let's focus our energies on implementing what is already known to work as ongoing research discovers more interventions. One thing I'm sure of is that we are going to discover other things that work. But for now, let's implement the ones that we already know to work. Thank you very much. Over to you, Ivan.
Thank you so much, Dr. Keith. In another world, would I think have been applauding you or something like that, but I have a feeling everyone, wherever they are giving you the much needed applause. Now, we're going to take questions. We're going to start with the questions that were asked on the chat and in the Q&A section, and then we'll conclude this with a couple of hands that were raised. So, Doctor, I'm going to read in a lump of about 3 questions, and then you have a go at them, and then we take another 3, like that, until we try to conclude all of them. So the first 3 questions were centered around asymptomatic cases. Someone was asking, do asymptomatic cases spread COVID? And also, are the bodies of people who died because of COVID-19 infectious? Then Ronald, who has recently been down with COVID-19, says that he has completed his 14 days of self-isolation and medication. When should he go back to get another test? So if Doctor, if you could have a go at those 3 and then we take the next round.
Thank you, Ivan. About symptomatic cases causing spread, it is true that both patients who have symptoms and those who don't have symptoms can spread the disease. That's why if you moved out of the building, you don't know who has the disease and who doesn't have, unless they have tested and they tell you. So yes, symptomatic cases can spread the disease, so can asymptomatic cases. In fact, there is some evidence which shows that 60% of the spread is as a result of asymptomatic cases. So let's put on our face masks all the time. And if you've been on treatment, after 14 days, you can always go back for the test. After 14 days of treatment with COVID, you're advised to go back for the test. You can do the antigen test or the PCR. You're good to go. Now, bodies of COVID-19. The way COVID-19 spreads, if you follow the presentation, largely COVID-19 bodies are not infectious. Largely speaking, they are not infectious. You can't compare them to Ebola. You know, Ebola spreads through touch. So if you touched a body of an Ebola patient, you would probably contract Ebola. But for COVID-19, because it spreads through aerosols, yeah, but it can also spread through contact, getting in touch with contaminated surfaces. Yeah, probably that's why people have to take precautions, because if you touch maybe a place which has been contaminated by the body, then you would get infected, but the risk is really minimal. Thank you.
Okay, so Doctor, our next questions are really centered around vaccination, sort of trying to debunk the myth that have gone around about vaccination. The first question is, can the vaccine affect breastfeeding mothers? And then the next question is, after just a moment. Yeah, after COVID infection recovery, how long should one wait until they get the vaccine? And then finally, a question on the alleged relationship between the vaccine and COVID-19 death. Someone is asking you to speak to the rumor going around that many of the people who have succumbed to COVID-19 got vaccinated when they had the virus, and that is what killed them. So if you could have a go at those, Doctor.
Okay, thank you, Ivan. The first one about the vaccine is safe for breastfeeding mothers and it's effective, but also for pregnant mothers. You know, we have pregnant mothers with severe disease in the COVID treatment unit. So yes, the vaccine is safe. The unfortunate bit is that we don't have a vaccine. So, but we're expecting the vaccine. If the vaccine was available, even breastfeeding mothers would probably take it on. So yes, much as we're talking about the vaccine, it's not available for everyone. Yes, about recovery. If you recover from COVID, now research on COVID is evolving. Latest evidence shows that if you recover from COVID, your natural immunity may last some months. But what I know for sure is that vaccination offers better immunity than the one you acquire from recovering from the virus. And also, as you know, there are many variants. So you may naturally get immunity against one variant, so you may not get immunity against another variant. So 1 month is enough. After you've recovered from COVID, 1 month after recovery, you're good to get your next vaccine. Number 3, the vaccine and COVID-19. So yes, this is a rumor that has been going on, that people who are dying got the vaccine. It's possible that if you got the vaccine when you already had the virus, and maybe the virus was replicating and you didn't know, and then you get the vaccine, what will take you down is not the vaccine, it is the COVID that you had, and it may be moving through the stages. Let's say you had COVID and maybe it was asymptomatic. Then you went in for the vaccine. So now, mind you, the immunity builds after 14 days. So this virus that you already had is maturing. It has moved. You move from mild to moderate. So that immunity that you got from the first dose, that dose may not have come in, and so you would not be protected. So the data is still being collected, but largely speaking, that has been a rumor that people who are dying got the vaccine. Me, the last time I talked, I have a colleague who is in ICU, so I asked him if the people who were in ICU were vaccinated, and they mentioned to me that none of them were vaccinated, in fact. So, but this was in one place. So we need to do a study around Kampala to find out whether it is true that those people who have severe disease or who are in ICU were actually vaccinated. But this is highly unlikely because only 0.01%, sorry, only 0.01% of this population, 0.01% of this population has about 0.1% of Ugandans have been vaccinated, precisely 800,000. So we cannot blame the vaccine unless we have data. But what we know from other countries, I have some data from India, which showed that people who were vaccinated, none of them died in the second wave, and only 0.6% ended up needing oxygen. So this shows you that actually those who were vaccinated were protected. Thank you, Ivan.
Thank you so much, Doctor. So far we are going on so well. We're getting more questions, but we're now going to the next cluster of questions that have been asked. Someone asked a very interesting question, Doctor, and I think you had spoken about this, but I feel pressed to just say it out. And this question is going out verbatim. What if the virus is in the air, suspended, and then you knock it with your eyes being the contact? Haven't you contracted COVID-19? That's a very hilarious one, Doctor, but you will take it, I think. Someone also is asking you, I know, someone else is asking you, Doctor, to speak about the use of Uganda Waraji and drinking it religiously when it comes to solving COVID-19. And maybe finally, in this segment of questions, someone is asking you to speak about why there is a lot of clotting in COVID-19 patients, those that have been vaccinated.
Thank you so much, Ivan. Let's start with now, this route, honestly speaking, this route of the eyes, first of all, carries a very low risk. The main risk is with the root of the nose and the mouth, and that's why there's a lot of evidence for face masks. Now, about the eyes, of course, I would imagine, like someone has mentioned, if you knock the virus, it depends on the number, really. That's what I would say. And that's why we're saying that when you're exposed to the virus, it's not like one virus is adequate to knock you down or to get infected. You usually need some good amount of viruses to overpower your immunity to take over this. So the route of eyes as a route of entry of the virus is low risk, but it is significant for people who touch. You know, in fact, when you're entering the COVID treatment unit, one rule they tell you is do not touch your face. Don't touch your face. And that includes the eyes, the nose. And you know how hard it is, because sometimes you want to scratch your eyes, sometimes you want to. In fact, the root of the eyes is even more significant for people who use specs, because as they're trying to adjust specs and things like that, I'm told there's someone who has specs, who uses specs, who got COVID more than twice. So that is unlikely that you will knock a virus suspended in the air and you get infected. Then for Uganda Waraji, yeah, people believe that because Uganda, we encourage people to use sanitizer which has alcohol, but the alcohol in the hand sanitizer is 70 to 80%. And I don't think there's any Uganda Waraji which is above that. Uganda Waraji is usually 40% or less. But that said, the virus usually penetrates the mucous membranes. That is the lining of the nose, the throat. So if you drink Uganda Waraji, chances are high that it is going to go down to your stomach and gets into your body. So it will not kill the virus, which may be in the nose, or may have moved down your respiratory tract. So I encourage whoever asked to desist from drinking a lot of Uganda Waraji. And the problem again with Uganda Waraji, it lowers your immunity, and your immune system is your biggest ally in the fight against COVID. Finally, about clotting. It is true that some people who got vaccinated got clots. And so far, the figure has been put at 6 for every 1 million. So if you vaccinate 1 million people, 6 may get clots. Now, good enough, scientists have moved ahead to identify the mechanism by which the vaccine can cause clots. It's called vaccine-induced thrombocytopenia. So this means that if someone got clots as a result of a vaccine, the treatment is already there. And so if you are ever to be vaccinated, stay in touch with your health worker. If you get unusual symptoms, you contact them. And now what we call VIT can be managed and has been managed. And that's why as we speak, we have 2.4 billion doses that have been administered. Thank you, Ivan.
Thank you, Doctor. Our next question is really, they're really focused around oxygen. However, for those that are asking, when is it safe to check again? I think what Doctor is trying to tell us on this call is you can't be very safe, you can't be very sure. Taste and taste and test. Now, the questions here are, Doctor, how can we increase oxygen uptake by our muscles in a home-based environment and treatment? That question is also backed up by what can we use to monitor our oxygen levels during this pandemic? The other question is it okay to wear 2 masks if I do not trust my work environment? And also, if someone wears a face mask for a long time, does it affect their oxygen saturation? If you could have a go at those, Doctor, and then we take the final batch and then have a couple of questions asked.
Thank you so much, Ivan. Now, about testing, I think testing is recommended it can be for individual benefit or for the benefit of people around you. So usually we encourage that if you have a contact, if you come in contact with an individual who has COVID, you can test to find out whether you have the virus, and that will tell whether you need to isolate or not. Like teams, say a group of people can say, since we have a contact, then we are going to test everyone. So that is one indication of testing. 2, if you have symptoms, which is, I think, the biggest indicator or the biggest reason why we test. If you have symptoms, you're not feeling well, yeah, then you can go in and test. Good enough, the tests are between 70 to 100,000 in most labs around town. There's MBN, there's Lancet, Victoria. Almost every hospital now is testing for COVID. And so if you have a contact, you are not sure, you know someone, maybe you can test early so that you monitor yourself early. And then you can test if you have symptoms. And finally, you can test to find out whether you have turned negative after treatment. Yeah, so you don't need to test like every time. If you test every week, I think that would be a waste of resources. Number 2, oxygen uptake. Now, when you're in home care, your body is able to deliver oxygen to your tissues. Even if you're in a face mask, when oxygen gets to the lungs, the lung has millions, in fact, over 400 million air sacs. These air sacs will receive the air, and their work is to transfer it to the blood. And from the blood, it is taken to all body tissues. So, what happens with COVID is that as your lungs get damaged, the air sacs can fill up with fluid, or the distance between the air sac and the blood can increase such that oxygen as a molecule cannot cross to the other side. And so the oxygen that ends up in the blood is little. And when you use the oxygen machine, which you put on the finger, it will detect that, the oxygen that is reaching the tissues is below the required amount. So How to increase oxygen uptake at home is to make sure that, of course, you delay the process, the lungs from getting damaged, but as long as your lungs are working well, that's good enough. So one way of improving the efficiency of your lungs is to exercise. There are some exercises you can check on YouTube. There's some exercises that are good for improving the efficiency of your lungs. Maybe that's one I would recommend exercise, because exercise will increase. That's why athletes are able to endure, because of this efficiency. Then about monitoring, I have mentioned that we use an oxygen saturation machine. It costs between 80 to 200,000. So if you have, if you have mild disease, really you don't need to monitor your oxygen. But if you feel unwell, you feel your chest is feeling heavy, you have chest pain, you can no longer climb stairs, you are able to shower before, now you are struggling to bathe, you can go to your nearest facility and buy the machine, or they check you for your oxygen levels. The alternative to monitoring oxygen levels is respiratory rate. Yeah, you can, if it goes beyond 25, 30, then you know that oxygen is not going in well. Masks, yes, double masking is okay, and it's encouraged for health workers, or even for those who, if you feel uncomfortable or you with the environment and you feel you should double mask, this is recommended, and you will not get suffocated. You can double mask whenever you feel comfortable. And finally, the face mask does not reduce how much oxygen. You know, these masks you get used, everything. I work on the TB unit, and TB is highly infectious. And in fact, for us, we work with patients who have what we call multi-drug resistant TB. So all the time when you're in that environment, you have to put on a mask. So your body adjusts to this new gadget you put on your body. So I would encourage people to put on masks. After some time, you get used to it and it becomes part of you. Thank you.
Thank you so much, Doctor. As we take our last round of questions, I would just like to encourage all those that might want to have a go at asking Doctor some questions to just prepare for going into that segment where you will have a chance to unmute and ask. Doctor, our last round of questions has questions centered around people with underlying conditions. The question here is, do asthmatic people recover from COVID-19? And is it okay to use inhalers as a way of mitigating the effects of COVID-19? And the last two questions, they're asking you, Doctor, to speak to people that medicate themselves with drugs such as vitamin C and DEXA, asking you to advise on whether that is okay. And then finally, Doctor, we've all heard about a COVID-19 treatment that was leaked from the Mbarara University of Science and Technology. They're asking you, Doctor, to comment about COVID-X and what you think about it, if you're really at liberty to say. And then that's basically it. We'll have the next round of questions after.
Thank you, Ivan. Now, about asthmatics. Yes, you know, this new variant, almost everyone is at risk of getting severe disease, not only those who have asthma. However, when you have any underlying disease, be it diabetes, hypertension, asthma, cancer, HIV, all these diseases, as long as they are well controlled, what do I mean? Every disease we are treating has a target. For example, if you have diabetes, the target is that your sugar levels should be, say, between 3.5 and 7. So if your sugar levels are well controlled, then you're not at higher risk as someone whose sugar levels are not well controlled. Similarly for asthma, asthma is it's a long discussion, but it's a disease that affects the airway. And the treatment for asthma usually is using inhalers. And there are over 100 different inhalers on the market, and each inhaler has a specific medication. So whoever has asthma, we would encourage them to have it controlled. We have what we call Makerere Lung Institute. They have a program for asthmatics to ensure they are controlled. So, having said that, the asthmatic should also use the same measures that other people are using. social distancing, using of face masks, staying away from crowds. Yeah, and that is the best way to prevent COVID, as far as we know now. Inhalers, yes. Now, when you get COVID, some people get symptoms of the nose, and they will use some sprays. There are some sprays that you can use to relieve nasal symptoms. There are those who will get symptoms in the airway, and they will use inhalers like budenoside. But this is not for everyone. So this is why you need to have a discussion with your primary caregiver to find out. These things of generalizing treatment are not good. That, you know, because X was given a budenoside, then I should also get budenoside inhaler. Each individual is very different, and I encourage you to, I don't know if it's expensive to see a doctor, but if you can see your doctor, not some people in the pharmacies, by the way, are not doctors. You go to a drug shop, you find a nurse, some are not. So it's always good that you take off some time, see a doctor, try to explain to them, have a discussion. There are so many doctors in this market who are willing to listen to your story and guide you. And this also goes for the next question about self-medication. So, you know, people just forward treatment. Me, this is what I use. Me, I use this. Me, I use this. And of course, people end up taking up that advice, which sometimes is wrong. For example, dexamethasone is used for patients whose oxygen levels has dropped or who have evidence of damage in their lungs. It's not for everyone. And these are people who may need oxygen therapy or even ICU. So really, if you're at home jumping, you're running up and down, your body is fine, enjoying yourself, you don't need dexamethasone. And now vitamin C has been shown not to be beneficial. So, you know, so your friend says, may I have this vitamin C, which you put in water and it dissolves. No, let me put this clear, that there is no specific treatment for COVID, especially for mild COVID. The specific treatment that is there is for moderate to severe COVID. However, for people with mild disease, you support. It is supportive treatment where you support the immune system to fight the disease. You support with vitamin D, you support with zinc, you keep yourself well hydrated, you rest your body and mind, you do some light exercises, and keep positive so that your immunity can fight off this virus. If for any reason symptoms worsen, now that's when the specificity of treatment comes in. We give you specific treatment, which may include oxygen therapy. But as you know, the majority of people fight off the disease. So someone who has no symptoms, you just need to observe. Someone who has mild symptoms, you can get treatment to symptomatic treatment. Maybe if you have a cough syrup, you can be given something. Maybe if you have pain, headache, you can be given something. And then you take your tea, take your fruits, enjoy yourself as you wait for the virus to go away. Finally, I've got COVID-19. Now, like I'm just saying that your best ally against the fight of COVID is your immunity. In fact, that's why you see COVID affects some people who are older or who have certain underlying conditions, because it's about the immunity. It's about the immunity. Now, because your immunity is your biggest ally, anyone can come in and say this is what worked, and unless it has been researched to show. So I can also come up with something and I mix things and I tell you that it worked. But at the back of your mind, I'll probably know that it's your immunity. So about COVID-19, COVID-19 is good, but unfortunately, it has not gone through the stages that other drugs go through to be proved. It's my prayer that COVID-19 is taken through those stages, trials, which include phase 1, phase 2, phase 3. And I would be glad to have it on the market, because I mean, this would be a game changer. So if it's working for a few, it may not mean that it's working for the majority. So it's my hope that the team in Bara University will come on, and the patients on whom to do studies are available. So if it's approved, would be glad. Thank you.
Thank you so much, Doctor, for taking time, and I hope you will take a couple of more minutes to just answer a couple of questions that are going to be asked. So I encourage you to just raise your hand. We'll be able to unmute you, and you'll be able to speak. So our first chance goes to Richard Komakech, who has raised his hand. Richard, you're unmuted. You can ask a question. Richard, if you could unmute and ask a question. Richard Komakech. Okay, as we probably wait for Richard to unmute, Rose, someone with the username Rose Flower, you can speak.
Yes, hello. Thank you so much. Thank you so much, Dr. Keith, for the presentation and really for answering our questions, because you know everyone is scared, and when we get such from a trained practitioner, we get some courage. I just wanted to just do a follow-up question on COVID-X. I know what it is, and I don't know whether you'd be comfortable to really share openly, but just a direct question. You just said it is good. So for someone who has it, what do you recommend? Can they use it? Thank you.
Thank you for that question. Now, well, what I mean to say is that as a trained scientist, science goes through processes. Something may be good, but if it has not been taken through the steps that it needs to go through, and these steps include establishing whether it is effective for everyone and whether it is safe for everyone. And this process includes getting a group of people. You get a group of people who have COVID and give them COVID-X, and get another group of people who have COVID, but you give them something that looks like COVID, and then you follow up and get results, and we call that a randomized controlled trial. So if you compare these two groups, and that's how they discover all the drugs that are available. And they did this for hydroxychloroquine, which is making rounds on social media, and there was no benefit. They did this for ivermectin, and there was no benefit. They did this for remdesivir, there was no benefit for some patients. They've done this for convalescent plasma. There are so many tens of drugs that have been tried, and initially they were thought to work. So yes, for now, if you have COVID-X, I wouldn't recommend using it because we don't have data to support its effectiveness and efficacy. Thank you. And safety, yes.
Yeah, thank you so much, Dr. Keith. We are going to take two more questions. We have got a question from Erin Kamukama, and then we had another question from Patricia Namara. So we're going to take Patricia Namara's question, then we'll take Erin's question, and then we'll close this out. Patricia, you can unmute and speak.
Thank you so much, Doctor, for the amazing presentation. It's very informative, and it's really good. So my question is, what exactly breaks down in the lungs? What can you do when on home care? Thank you.
All right, thank you for that question. Now, when there's mucus in the lungs, Unfortunately, I don't have an image of the respiratory tree, but the respiratory tract starts from the nose, goes to the throat, to the pharynx, to the larynx, the trachea, and then the bronchi have about 20 branches to the smallest branch, and then you have air sacs. So when you get COVID, the process starts down from the air sacs. That's where the fluid accumulates. Then it may involve the airways and things like that. So what you may do when you have mucus, there are some maneuvers where you do massage, especially at the back. We encourage people to do massage at the back. There's some videos you can check on YouTube on how to relieve mucus. That's number one. Two, you lie on your stomach. So when you lie on your tummy when you have COVID, it helps to clear your air sacs that are at the back. Yeah, so most of the time, if you are at home, you try to lie on your back. The other thing that we recommend is inhalers that include budesonide inhaler. Yeah, this one can, but this is usually for people whose oxygen saturation is dropping. It's not that every COVID patient gets mucus, that's a myth. If maybe that's when your breathing is worsening, that's when you would worry about it. But for most people, no, it doesn't happen. So, people think steaming breaks down the mucus, but really, how far can steaming go to the lungs? I've told you the branches that someone has to go through to reach the smallest level. So it's unlikely that if you had mucus deep down at the air sac level, and mind you, COVID mainly affects the lungs at the testes and the lungs at the periphery. So the methods that I've highlighted above are the ones that I would recommend. And maybe sometimes they will give you a cough syrup, which has a mucolytic or something that can break down the mucus. Yeah.
Thank you so much, Dr. Keith. Erin, you will have your question. Please unmute.
Yes.
Erin, we seem to be losing you. You need to unmute and speak.
Yes, thank you, Dr. Keith, for the presentation. I just wanted to speak to the concoctions that many of us are worried that we are not using. I have seen lots of herbs going around, the purple weed. I have seen some oils that people are saying that we should use to try and relieve ourselves of the virus. So some of us are worried that we are not doing enough, we are not steaming, we are not using the herbal medicines that people are using. Are there any dangers to some of these things? Because I've also seen some people, so I just want you to just expound more on the concoctions.
Thank you so much, Erin. Maybe, Doctor, before you take that question, the query is coming in here asking whether you are available for private consultation. So probably if you could move to the first part of your presentation, just give people your contacts in case they want to reach out. Yeah. Otherwise, feel free to take that question as our last question as we wrap this up.
Thank you very much. Now, about concoctions. Now, friends, I've worked in the COVID treatment unit. I worked there in December. I worked there in January, and I'm actually going there in another 2 weeks. I don't do any concoctions. I don't do any steaming. And I have a family. I'm married with 3 children. And of course, I know that I'll probably put them at risk of this virus. But my biggest defense is the face mask. When I'm in the COVID unit, I know that the most important thing is the face mask and hand washing. Of course, it's not easy to comply to some of these things, but that is all we have for now. And what I try to do also is I try to rest. I try to rest. I also try as much as possible to do a balanced diet. Of course, because of the fear that is associated with the disease and images going around, people dying, like everyone wants to catch on a straw or something like that. But I can assure you that if you just social distance, if you can stay away from crowds and you do your masks and very well properly, not like half-half, and if you're going, you have like that high index of suspicion, you look at everyone as not in a stigmatizing way, but anyone can potentially be infectious. So when you meet your friend, you do a distance of 2 meters. But also I forgot to mention people get infected at meal times. You go into a restaurant, it's meal time, you remove your mask. Sometimes people will eat forever and forget to put their mask on. When you go to a restaurant, eat as fast as you can. If it's possible, you take food and eat at your place back. You try as much as possible to minimize places that have the infection. Me, I think that is the best, and that's the evidence we have. These other things, by the way, I've been practicing for 12 years. It's the biggest challenge we have. You give someone ARVs and they want a concoction. You give someone diabetics drugs, they want a concoction. I don't know whether it has to do with our culture. You give someone drugs for TB, you find them on a concoction. So this concoction business is not happening now for COVID. It is widespread even in other cancer. Particularly, I had a cancer patient at home whom I knew was end-stage cancer, and relatives were recommending concoctions. So I think it's a culture that probably will change over time. These things, purple weed, steaming, and other things have not been proven to work. I saw someone saying, can they go to steam now that they have recovered? Steaming with groups, what if you get infected again? What if you reach there and you get the infection again? Yeah, so you don't want to encourage people to get infected. So this steaming, there are so many concoctions that are going to be on social media, everyone, that's why they are calling us herbalists, Ugandans. We are coming up with all sorts of things that do not work. But we know what works. Let's do what works. Thank you.
Thank you so much, Dr. Keith. It's been a wonderful afternoon learning from you. Surely, I believe after what you have shared, all the 100 and something people on this call will not be herbalists, but will adhere to all the outlines that have been laid out clearly to fight COVID-19. Allow me in a special way, on behalf of the Innovation Village, to extend a hearty vote of thanks to you. First of all, for being at the front line of fighting this deadly pandemic, for putting your life on the line for our country. We do pray that one day God will give each one of us an avenue to say thank you to all of you, the frontline workers. Thank you for everyone that has taken time to be on this call. I do believe that you all managed to register with your email addresses. We are going to share the recording with each one of you so you can go over this with your family members. You can play this out in the evening, probably before news, and you just get everyone to understand what this pandemic is all about and demystify all the myth out there. I would like to thank the Innovation Village for organizing this, and I would like to ask each one of you to have a lovely evening. Stay safe, keep those masks on, and let us fight against this stigma. Those guys that are sick with COVID-19 are one of us. They're our parents, they're our brothers, our sisters, our friends. Do not go on with this stigma. Let's fight COVID-19 together. Thank you, guys. Enjoy your evening.
Thank you, Ivan.